name is Jackie Ross, and I'm an ambassador for Women's Health for the 2025 St. Francis Gala. I have been a registered nurse. I graduated from nursing school in 1975, so 50 years this year I'll be a nurse. The majority of the time in nursing I spent in critical care and emergency room nursing, so I spent a lot of time teaching people about their own health. I found a lot of times that the people I was taking care of had illnesses that could be prevented if people would simply take care of themselves. I tried to be an example to those people by doing the same thing myself. If anybody who knows me knows that I'm really into fitness. I tried to eat healthy, exercise. I taught people how to stop smoking, taught exercise classes for over 30 years. And I had a program at the hospital that helped people to lose weight and to incorporate changes into their lives that help them to become healthy as well. So about, I guess 3 years ago now, I was working at the health fair that Mosaic was having out at the community center, and I won a heart screen, a CT scan that they had up for a prize. And it took me probably close to a year to go and have it done. So I went and had it done because it was free. I honestly believed that my heart was absolutely fine. And I had it done. And Jordan, one of the techs at the time, noticed that my heart had a bit of an arrhythmia, so that my EKG looked a little bit funny. But I didn't think too much about that. I think I'd had that before, and I have a history of high blood pressure, so I had been seeing a cardiologist. But a couple years later, I started noticing that I was significantly short of breath when I was walking. And it got to the point where I could not walk around the track at the community center more than 3 times without stopping, which is very unlike me. At that point, I went back to my cardiologist. I was also seeing a pulmonologist because I do have asthma, so I assumed that was what it was. But the nurse practitioner at Dr. Grant's office noticed an arrhythmia, put me on some medicine, and ordered a stress echo. And that's when they found out that I had some pretty bad problems with my heart valves that I was not aware of. About a week after that, Dr. Grant sent me down to see the valve team at St. Luke's Hospital in Kansas City. And my surgeon, Dr. Davis, told me I had really bad heart valves and that I needed to have them fixed. And a week after that, I went in to have open heart surgery to replace my aortic valve and repair my mitral valve. And that was an experience. I believe at that time I realized maybe I wasn't as nice to my patients as I should have been as a nurse, but everything went well. And now almost a year later, I feel like I'm maybe back to myself. I'm back. I want to pay tribute to my cardiac rehab nurses at Mosaic in Maryville, and to my personal trainer, Jake Volstead, who got me right back where I wanted to be. So I've come to realize that just because I took really good care of myself, that does not mean that I'm going to be completely healthy. I want to encourage women to not only exercise, not smoke, eat right, manage stress, but also to take advantage of the screening tools that are available from the medical community, to learn about them, make sure that you do them, get vaccinated, get tests, do cholesterol levels, see your physician on a regular basis, learn about what a prudent, heart-healthy diet is, what a healthy diet is. Go and get some exercise, even if it's just walking on a regular basis. Get up and move, because if it can happen to me, it can happen to anyone. So I agreed to be an ambassador this year because I really believe that preventative health is the way we have to go. I mean, heart disease is the #1 killer in this country of men and women, more than all the cancers put together, more than accidents, more than anything else. So we have got to start preventing that instead of just trying to fix things in the end. And as I've told you, it doesn't always work, but think I tried to think on what my rehab would have been like if I hadn't been healthy in the first place. And I'm just grateful that I was doing what I could before, and it made my rehab a lot easier.